Welcome, everybody. Thanks for coming to this community forum at the Muskegon Project. This is an exciting one because we are in person, so it's nice to see people's faces, as well as on Facebook Live. Today's presenter is Bill Drenik. Bill is a Medicare insurance specialist with Senior Resources LLC. And today, Bill is going to provide an unbiased presentation on Medicare and open enrollment. And we'll have time for questions at the end. So if you're at home on Facebook Live, just comment your questions and we'll make sure they get answered. So thank you, Bill, for being here.
Thank you. Well, thank you, and thank you for coming. And I'm back again, like last year. We like to do this every year. This is an important time of year for people who are on Medicare and anybody who's about to enroll into Medicare to determine if they should enroll at this time or maybe delay it till later. So again, as Julie said, my name is Bill Drenik. I am senior partner of Washington Senior Resources. I'm also a high school teacher and retired and got tired of retirement. Let's put it that way. Retirement was not for me. So somehow or another, I fell into this crazy business called Medicare, and it's very complicated. And I love it because I love to educate. I don't like to sell things. So I educate people on how Medicare works based on their information, their medications, and their doctors, and any benefits that are important to them, such as dental, hearing, ancillary benefits, any other types of benefits such as acupuncture, chiropractic, those types of things are rather important too, because all the plans are different. In Pierce County, how many plans are there in Pierce County? Can anybody tell me? Neil can't say that because Neil knows. There's over 50. So how do you determine out of those 50 plans which is the best for you? It's a difficult process. You can do it, but it's a difficult process, and some people make mistakes, and that's the problem. Because every plan has a different list of medications that they cover. It's called a drug formulary. So your medications will be covered on some plans, but maybe not on others. And that's important to know because you want to be able to understand what your costs are going to be and whether they're going to be covered for that year. Because if not, then you have a retail price and that can be quite expensive. So we'll move along here a little bit. I'm not connected or endorsed by Medicare. I'm an independent broker, and I don't represent all the plans in the county. I have to say that because some plans do not contract with brokers. So you would have to go to Medicare.gov, find out which ones there are. But substantially, just about all of them in this county I am contracted with. So what I do is I narrow those 50 plans down to the few that meet my clients' needs. All medications covered, doctors are contracted with those plans, because doctors don't contract with all the plans. So that obviously is a part of it that's very important as well. So we'll move along here. I am licensed local and I am biased. It doesn't matter to me which plan my clients enroll into, or because what's important is to make sure they're in the best plan for their needs. So my job is to educate people on what their options are, and then my clients decide this is the plan I think is best. And many times I have clients say, Bill, what is the best plan? What do you think? No, I'm not going to suggest what plan you should enroll into. Here are the top 3 that cover all your medications, all your doctors. You want a dental, you want a chiropractor, and so here are your options. You're going to choose yourself. Usually I know what plan they're going to choose because it's pretty obvious many times. So I educate my clients on their options. Like I said, taking into consideration their physician's medication and other benefits that are important to them. Dental, vision, hearing, gym membership. I have, surprisingly enough, I have some clients that will enroll into a plan because they want to go to the YMCA. And not all plans are contracted with the YMCA. And that's important to them. It's a free membership. So if their medications match and their doctors are contracted, then they can go ahead and that would be a good move for them. So once I educate my client on their plan options, my client chooses the plan they feel best fits their individual needs, and I assist in the enrollment. Now my client is confident, and that's one of the real important things to know is that I am confident that the plan I am in best fits my needs and for my financial situation, because there are different costs involved, right? My services don't stop there. I always make myself available year-round to my clients. No doubt somebody's going to get a bill they shouldn't have received, or they're going to forget that it's my dentist in the network, or how do I process a enrollment into the hearing aid program, how to access my hearing aids, what audiologist do I go to? Those types of things are rather important. Tell my clients, call me first, don't call customer service. If I need you to call customer service, then I'll tell you to do that. And if you ever have to call your plan, Medicare or Social Security, what you need to do is make sure you write down the time, the date, and the person you speak with. Everything is recorded. So you have some recourse if you're given wrong information, they can go back and pull that recording. As I said, I'm available year-round. Now we're coming up to annual enrollment. This is the time of year that I get very, very busy. I have around 700 clients, and I offer to review their plan for them at this time of year. Why review them? Because plans, as I mentioned, have a drug formulary, and there are medications that might be covered this year on your plan that will not be covered next year on your plan. And I brought an example up earlier of I had a client who was on a medication called Revlimid. It's a cancer medication that costs them $6,000 a month before you turn on Medicare. Got him onto the Medicare plan where it was covered, paying around $1,200 a month for it. But when we did the review at the end of the year, we found out that that medication was not going to be covered on this plan for the following year. So it's very important that people, they have a broker, use your broker, you ask them to do a plan review for you. Very important. And you need to make sure that your doctors are also contracted with the plan for next year. What I did do is I moved him to a different plan that did. Yeah, so he was fine for the next year. But if we hadn't done that, and he moved into the next year, and this was a couple of years ago, and at that time, you couldn't, you did not have another opportunity to make a plan change. We'll get into that a little bit later. It's called open enrollment. After January 1st, we'll get into that. So, yeah, so you've got a broker use their services. That's what we're paid for. That's why we get paid. There's no cost to the client. The insurance company reimburses us, and they give us a commission, I should say, to take care of the clients. And so we're kind of the extended arm of customer service, really, for them. Really the ones that really give them the service that they need and require. And of course, as I said, there's no cost for services. So these are the Medicare enrollment periods. This is right here. Initial enrollment is the 3 months before your 65th birthday, the month of your birthday, and the 3 months after. That's a 7-month window which you can enroll into Medicare if you need to. Annual enrollment is coming up very quickly. October 15th through December the 7th is when you should have your plan reviewed to make sure that it's still going to be the right fit for you next year. If it's not, then we find you a different plan. Open enrollment is January 1st through March 31st. Now, this is fairly new in the last couple of years. What Medicare is allowing people is those that did not check their plan or do a review during annual enrollment, gives you one more opportunity to review your plan review to see if it's still going to work for you. What will happen many times is that people will go to their pharmacy in January pick up their medications, and the pharmacy says, well, this medication is now costing you $350. Why is that? I planned covered it last year. Well, I covered it last year, but it's not covered it this year. So what now? Well, now you have one more opportunity. That's when you call somebody, a broker, and say, I need to find out what plan covers all of my medications, including the one that's not covered this year. Because last year it might have cost $45, now it's $350. So, very important. Special enrollment is when somebody loses employer coverage, they're past 65, they're still working. As a lot of people are doing that now. They're holding off retirement because things are getting a little tough. Cost of living is very difficult, inflation, etc. You do that, and let's say at age 67, you decide you're ready to retire. Then you have what we call a special enrollment period where you can go ahead and enroll into a Medicare Advantage plan or supplement plan. Also, if you're moving out of the service area, let's say you're moving from one county to a different county, and the plan you had was not available in that other county, then you have the opportunity to make a plan change. Also, if you are what we call dual special needs, those are people who their incomes are around $1,000 a month or less. They can apply for a dual special needs plan. Gives them a lot of benefits. The cost of medications are extremely low. We really take care of those people that need it, and that's a good thing. So that is special enrollment. So this is what your Medicare card looks like. So you can sign up, say 100 days before your birth month. So 3 months before your birth month, you can go ahead and apply for Part A and Part B if you need to. Now, you may not need to enroll in Part B. Why? Because you have employer coverage still. You're still working. Now, if you're retired and you have it, you may have to enroll into Part B. So you want to call Social Security and ask these questions. You can always call me first and say, you said something about Part B and Social Security, I wasn't sure. Give me a call, I'll be happy to have a discussion with you about that. And here are the numbers here. What I suggest is SSA.gov, Social Security Administration, SSA.gov is actually the best place to go to enroll in Medicare Part A and Part B. And the reason being right now is the local offices they're on overload. They're understaffed after COVID, and it takes quite a while for them to process an application. But if you do it online, it gets processed a lot quicker. So these are the 4 parts of Medicare. You've got hospitalization as Part A. That is an entitlement. If you have worked for 48 months, 40 months or more, 10 years, then you or your spouse has, then you are eligible for Part A at no cost. Part B is medical. Now, let me go back to Part A: hospitals, skilled nursing, hospice, and home health care. That's what that covers. Part B covers all other medical services, basically. Your doctors, your labs, outpatient, physical therapy, on and on. That is part of Part B. And there is a premium for enrolling into Part B. This year it's $170.10. Surprisingly, it's going down next year. The one, it's $164.90, I believe, is what it's going down, about $6. Not a lot, but better than going up. Year before it went from a $148.10, I think it was a $148.50 to $170.10. It was a big jump. But now that it's coming back a little bit, I've never seen it decrease. So Social Security also. Social Security will also go up as well. Yeah. Last year, Social Security went up, and so did Part B to just about the same amount. So Didn't really say much. So Part C is what we call Medicare Advantage. Part A and B were actually established during the Johnson administration in 1964. And we're going to jump over to Part C here is Medicare Advantage during the Clinton administration, I believe in 1996. Part C started, which included Part A and Part B. And then in 2006, during the Bush administration, they established Part D. That's for prescriptions. Part C includes hospitalization and medical care, A and B, and with 90% of the plans, they also include Part D prescription drug coverage. So Part C is what we call Medicare Advantage. And that's what most people by far enroll into. It also has covered your hospital, all your medical needs, and would have a prescription drug plan. And the prescription drug plan will vary from plan to plan, as I mentioned, so that's very important to know. Part D. Now, when I said here includes Part A and Part B, it can include Part D. What would be the situation where somebody would not want Part D prescription drug coverage? You're going to take yes or no requirement.
If they were on any medication.
Or not have one of the medications, but what happens if you don't have it? You have a penalty once you enroll into it. So you need to have prescription drug coverage. Then again, why again? Who wouldn't need Part D? Well, if you are receiving VA benefits, you're the one class that does not need to enroll into a Part D because you're getting it through the VA. However, veterans are the only class also that's allowed to have Part D through VA and Part D through a Medicare Advantage plan if they wish. You're on a supplement plan, and we'll get to those in a little bit. Supplement plans are a little bit different from Medicare Advantage. They cover, for example, a plan G. For example, you might have let's say $200 monthly premium, and you have a deductible of $233 for annually for the year. Once you reach that amount, you have no other cost beyond for the rest of the year. So you could be in the hospital for 6 months, you're not going to be a dime. Medicare Advantage plans, they cover hospitalization also, but most of the plans we're going to have a maximum of around $1,800, $1,900, $2,000 maximum amount for any extended stay in the hospital. Let's say you're in for 6 months, that's going to be your bill. So it depends on how many services, how often you're accessing services also. If you're accessing a lot of chemotherapy, radiation, radiology services, those types of things, that can add up over time. So everybody's obviously a little bit different in the types of services they access, and those costs can vary quickly. Some people love supplement plans, and they're a little pricey. So, for example, if they're, let's say, $200 a month, so you figure for the supplement plan plus your deductible of $233, figure you're going to be, your medical costs are going to be $2,600 a year, whether you use the plan or not. But it's never going to be more than that. And if you have a lot of health issues, history of a lot of health issues, a supplement plan may be a good option for you. So original Medicare. Now this is original Medicare. You remember the red, white, blue card? You turn 65, you got a red, white, blue card. You haven't enrolled into a Medicare Advantage plan yet, or a supplement plan, a prescription drug plan yet. You just have your Medicare Part A and B. So Medicare Part A, you have a deductible of $1,600 for days 1 through 60. It's $400 copay for days 61 through 90. $80 copay, 91 if you want 50, and then after that, you pay all costs. It can really bankrupt somebody. So the thing is, I always highly recommend for people to come off a original Medicare A and B and to enroll into either a Medicare Advantage plan or a supplement plan. Because as I mentioned, the most you're gonna pay for a hospital stay on a Medicare Advantage plan is usually gonna be no more than $2,000, no matter how long you're. I can't, well, this is an educational seminar. I can't speak specifically about plan benefits for specific companies, but I can give you kind of an idea of what those costs are. Part B, that's your medical insurance, right? This is when you go see your doctor, you go to the lab, you get x-rays, you have outpatient surgery, the day surgery, you go home the same day, that's outpatient. Other services like that are under Part B. That's a monthly premium now, it's going to go down to $164.90 in 2023. Yeah, there is a annual deductible on Part B, only if you're on your standard Medicare A and B card, okay? And you pay for services 80% of the services after that. So 80% of what we don't know. So this is what we call a percentage. It's called a co-insurance. Co-payments, and we'll get to that a little bit later. Co-payments is a predictable cost, but this is the co-insurance, and so your costs are pretty much unknown. That's why it's important for people who are on a red, white, blue Medicare, standard Medicare, look for another option. You will notice, though, in Medicare Part A and B on your card, what does it not cover? Correct. Very good. You got an A for the class. So no prescription drug coverage. So you have your red, white, blue card. This happened. I had a gentleman call me. Gosh, this was probably 5 years ago. He said, "My friend said to give you a call. You're his Medicare broker." I said, "Yeah, I'd be happy to help you. What's going on?" He said, "Well," he said, apparently I need a Medicare, I need a prescription drug plan, and my doctor just prescribed me a medication." "Okay, what plan are you on right now?" He said, "Medicare." I said, "Okay, well, I assume you get Medicare Advantage plan." I said, "Well, what plan?" He goes, "Medicare, red, white, blue card." And I said, "What's your prescription drug plan then?" He goes, "Well, I don't have one." And I said, why don't you have a prescription drug plan? And he said, "Why do we need a prescription drug plan? I don't take medications." So it's a reasonable question to ask, right? I said, "Well, how old are you?" Because I'm 72. My doctor just prescribed me a cholesterol pill. Healthy guy. But now what happened? He went 7 years without a prescription drug plan, and now he has a penalty. It's 1% of the national average, and we'll get into that a little bit here. I'm jumping ahead a little bit. This is a good time to talk about it. 1% of the national average. So the national average right now for prescription drug plan is around $40. So what is 1% of $40? 40 cents every month. And over time, back 7 years prior to him, when he turned 65, it was probably $19, $20 was the average. So that would be 20 cents a month. So I said, "How do we determine that?" And I kind of did a quick calculation. I said, "Well, call Medicare to find out what your penalty is going to be. But it's going to be between $25 and $35 is my guess." He called back a couple of days later again. I called, my penalty is $27.50. And he said, "What do I do?" And I said, "Well, you have two options. You don't have to do anything right now. Just buy your medication over the counter. Probably going to cost you $10 a month. And you don't have a penalty because you haven't enrolled in prescription drug plan yet. But if you enroll into a Medicare Advantage plan that has prescription drug coverage in it, then you're going to have a penalty of $27.50 every month for the rest of your life." And he said, "What should I do?" And I said, "Well, I can't tell you what to do, but consider this. What happens if 5 years from now, the doctor says, Harry, you have COPD and you need an inhaler. That's going to run you $400 a month. Well, if you're on a Medicare Advantage plan, that inhaler could cost you maybe $40 a month." So he said, "You know what, I think I'll just go ahead and invite it, eat the $27.50 per month, enroll into a plan, and now I know I have prescription drug coverage should I get prescribed another medication? And that's what we did. So what is a Medicare Advantage plan? It, as I mentioned earlier, it includes Medicare Part A, Part B, Part D, and most of the plans, and some extra benefits. You see a little gym membership here, hearing aid, dental, vision, and on each plan it'll be a little bit different. So that's why these ancillary benefits is what we call these here. It's good to know, okay, we've got your doctors, we've got your medications, but prioritize what is most important to you next. Is it dental? Is it hearing? Is it a gym membership? Whatever it is. And then we determine what plans, options you have. Types of Medicare Advantage plans, there's HMOs. There's used to be HMOs, which your doctors must be in a network. You have to work within the network. So let's use CHI Franciscan, for example. They have a network of doctors, and your doctors are within that network, HMO. If you go to a doctor outside of that HMO, then you can have to pay the full cost. So, and you, many of the plans are going to require referral. So for you to go to a specialist, your primary care doctor has to give a referral in order for you to go to see that specialist. You just can't go on your own. HMO POS, it's also have a network, but for certain services, you can go outside that network. For example, dental. Some plans have dental coverage. They have a network of dentists that you can go to. And that you can also go outside of the network, but at a higher cost. PPO is a preferred provider organization, and they have a network of doctors also, but you also have the ability to go outside of that network at a higher cost. In most cases, you don't need a referral, but you see a specialist. Basic Medicare terms, premium, that's the amount you pay for your monthly premium plan. Some of those Medicare Advantage plans start at zero. You don't pay anything monthly for it. How is that possible?
Deductibles.
Oh. What happens is when Medicare has a contract with a carrier called an insurance company, there's many of them out there. And they say, okay, this is what we're going to do. Based on your health history, when you sign up, Medicare will say, we're going to pay you, insurance company, so much a month to take on the responsibility of any costs over and above what your member is going to have to pay for. So you go to the hospital and you pay $400 a night. The company has to pay the rest of it. Now, what that amount the company gets from Medicare every month is kind of an unknown thing. It's based on your health history. So how this works out is that once you enroll into a Medicare Advantage plan or a supplement plan, now Medicare washes their hands of the responsibility to pay for your 80%. Because on Medicare, you saw earlier, it's kind of an 80-20 split. You pay 20%, they pay 80%. Medicare says, insurance companies, you know how to manage this better than we do. We're going to pay you so much a month. And so they're getting money from the government to offer these plans. So for many of them, they will have a zero monthly premium plan. They're getting money already from the government, from Medicare. And they can charge zero, they can charge $55, they can charge $150 a month. And with what usually happens when you have a plan that has a higher premium, your co-pays are less when you have these services. So people who are very healthy, they go to the doctor once a year and take generic medications. They may say, well, I think I'll enroll into a zero monthly premium plan. Why do I want to pay a premium every month if I'm just going to the doctor once a year? Well, the nice thing about you can change the plan every year. So your health might be going south that year and say, well, I'm going to take a look at a different plan because I'm accessing services more than I did in the past. I may be willing to go ahead and pay a monthly premium for my plan now this next year because my co-pays when I go to the doctor for services will be less. Deductible with Medicare Advantage plans, 99% of them do not have a deductible. So when you go to see your doctor, it may cost you $10 or $15. You go to the hospital, maybe $400 a night, no deductible. However, there's a deductible, can be a deductible on part D, the prescription part, and we'll get to that in a little bit. So we talk about co-payment and co-insurance. Co-payment is a fixed amount. You go to your doctor and you pay $15 to your primary care doctor. That's a co-payment. You go to the hospital and pay $400 a night. That's a co-payment. Co-insurance is a percentage. And with Medicare, usually it's 20%. So you pay 20% of the cost of that service. More and more of these Medicare Advantage plans are going to co-payment because we as Medicare beneficiaries like predictable costs. We like to know that when I go to outpatient surgery to have my knee replaced and going home that same day, which happens quite often, in and out, I want to know what that's going to cost. Is it going to cost me $400? I know $400. That's the copayment. If the plan says it's 20% co-insurance, well, 20% of what? That doesn't necessarily mean it's more than $400. It just doesn't, it's a predictable cost. So that was a complaint from a lot of beneficiaries and say, we'd like to know exactly what it's going to cost me when I go to a service. So can you please change the co-payments for most of your services, and it's moving more toward that. There are some that have co-insurance, for example, what we call durable medical equipment, which is oxygen, walkers, knee braces, crutches. There's hundreds and hundreds, if not thousands, of durable medical equipment. Well, you're going to pay 20% of what that retail cost is with that contracted provider. Okay, so that otherwise they can't go and they say, crutches are going to probably cost you $40. Oxygen cost you, it's a percentage co-insurance. So terms for understanding prescription drug benefits. We talked about formulary. That's your list of drugs, and drugs will vary from plan to plan. And usually, if the plan could be very robust in certain areas, with a formulary, each plan is required to offer so many medications for every area of need. So insulins, for example, some plans will offer a certain amount of insulins, or maybe 20 different insulins, and they may offer 7. This plan over here offers 6 or 8. Whatever that number is, Medicare says they have to at least that amount, and it could be different insulins, right? There's different types of drugs. And if you're prescribed a certain insulin, well, you want to make sure it's on this plan over here, not this one here, because it's not offered. So every plan has a different drug formulary. So when we're researching a plan for somebody, always look at them and say, what is it? What are your medications? How many times per day, capsule, tablet, etc. And let's make sure that all your drugs are going to be covered under your plan. Otherwise, you go to the pharmacy, you're going to pay retail price, and it's going to be substantially more. Tiers, there's tiers of medications. There's 1, 2, 3, 4, 5 different tiers. Some plans have a tier 6 medication. Usually the higher the tier, the more expensive. So a tier 5 medication is the most expensive medication there is. That was that cancer medication I was mentioning earlier that my client had was prescribed and got it from the pharmacy. Now, your Part D are medications that you get at the pharmacy. You can also get medications administered in a clinical setting, such as an infusion, but that falls under Part B. Part B, that is in a clinical setting. and you're gonna pay 20% of the cost of that infusion. Network, there are networks of pharmacies. They are preferred pharmacies and they are standard pharmacies. You always want to go to a preferred pharmacy with your plan. So if you say, I love to go to Fred Meyer. I shop there for groceries, that's where I pick up my meds, I want to make sure. Okay, well, let's make sure that, let's see if we can find the plan that also has Fred Meyer as a preferred pharmacy. So you can get your medications there. There's also mail order, a lot of people will purchase their medication via mail order. Transition process, that gives you a one-time bill for a drug. Let's say in the middle of the year, in June, your doctor prescribes you a medication. It's not in your formulary. What happens? Well, the plan that you're on will allow you to have a 30-day bill of that medication under a certain tier. Usually it's a tier 4, but you do have access to it. Gives your physician an opportunity also to maybe recommend another medication that might work just as well. At least get you through the year until we can do a new plan review for next year to make sure that that medications and all others are going to be covered. Any questions? Yep. Okay, your plan may also have these drug coverage rules, prior authorization. Some drugs require a prior authorization. Opioids is a big problem. So in order to get certain medications, you need to get them approved by the plan. What happens is the doctor will send in the medical records that she has in order to determine that you do require that medication. Quantity limits. Many of the medications you only get a 30-day supply, or others you can get a 90-day supply. Again, opioids and medications of that nature fall into that category. Step therapy. What this is your doctor prescribes you a medication that's a tier 2. And the plan says, you know, we have a medication that's a tier 1, it's less expensive for you, it's less expensive for us, and we find out it works quite well. They want you to try that medication first to see if it works. If it does not work, then you step up to that tier 2. So if you've already been through step therapy with a prior primary care physician or a specialist, you do not need to go through step therapy a second time. Supplement or Medicare plans. These are a little bit different than Medicare Advantage. One big difference is they don't include any prescription drug coverage. So if you have a supplement or also called a Medicare plan, you need to apply for a prescription drug plan on the side. We call them a standalone. The other thing about supplement plans is there is no network of doctors. You can go to any doctor in the country who accepts Medicare patients. And people like this. Some people say, you know, I want to go to Cancer Care Alliance. My mom was treated wonderfully there. I'm concerned that I might have that DNA, and I want to make sure that I can go there. And the other plans may not offer the Cancer Care Alliance to be in that network. The other thing is you don't need a referral or a prior authorization. You just go. But you're going to pay substantially more for a supplement plan than you will Medicare Advantage in most cases. So, as I mentioned, if you have a prescription, a supplement plan / Medigap plan, they both said the same thing. A supplement plan, Medigap plan, they're one and the same. They're just called 2 different names. You need to have a prescription drug plan then on the side. It's what we call a standalone. And in Washington State, there was 26 different prescription drug plans. So if you're on the supplement plan, we need to make sure that the medications that you covered, that you take are covered by the standalone prescription drug plan. You can only make a plan change during annual enrollment, October 15th to December the 7th. For a prescription, standalone prescription drug plan. As we mentioned earlier with the Medicare Advantage plan, you have open enrollment from January 1st to March 31st to make one more change if you need to. Be very careful with the standalone prescription drug plan. You can only do it from October 15th to December the 7th. And of course, formularies can change from year to year. That's why it's so important if you're on a Medicare plan to have somebody review your plan to make sure the medications are still being done and at the lowest cost. Also, what they call the Part D senior savings model. Many of the plans now are covering insulins at $35, where in the past they were quite expensive, and some plans didn't have this plan available. And even when you go into the gap of the donut hole, which we'll get to here in a moment, they're still going to be $35. There's no additional cost. I know it's a lot of information. It's like drinking out of a fire hose, as they say, right? There's a lot of information, very difficult to absorb. So, what is the gap or the donut hole? Everybody's heard of the donut hole, the gap? Okay, this is important for people to take expensive medications because here is a deductible of $505 for the year. That means a plan can charge $505 deductible before your copays start. Not all plans have it. Some plans will maybe charge you $160 for a deductible. But Medicare allows plans to charge up to $505 for 2023 for your medications. And before your cost of your medications, your copays and co-insurance start. And in many plans, the deductible will only apply to tier 3, 4, and 5 drugs, not generics 1 and 2. All plans are different, completely different. It's a little complicated. Okay, so you've been through your deductible. Let's say there's one and you have to pay. Now you're in your initial coverage. This is where you are going to be paying your the cost for your copays and your co-insurance for your plans. Once the total number, the cost of your medications reaches $4,660, that's what you pay and what the plan pays, reaches that number. And every month you get what we call an explanation of benefits document that'll tell you exactly what your medication costs were for that month and what the plan paid. Once the total amount reaches this amount, then you fall into the coverage gap and the cost of your medications can increase. Now, how do you get out of the gap of the donut hole? Now the rules change. Once you have paid out of your pocket, not you in the plan, but when you paid out of your pocket reaches $7,400, then you fall into catastrophic. Then the cost of your medication is going to be like $4.15 for generics, $10.35 for brand names, or 5%, whichever is higher. I have some clients of mine that fall into catastrophic. They take multiple sclerosis medications or injections. They get through the pharmacy, and those can run $1,700 a shot every month. So quite early in the year, they fall into catastrophic, and then the cost of their medication will be down. But it's quite pricey. Now the gap, the donut hole, is supposed to shrink and go away in the next couple of years, and we'll see what happens there. Late enrollment penalty. This is what I talked about earlier. A gentleman was 72 years old, didn't have prescription drug coverage for 7 years. He had a penalty. And so have to be aware of that also. So the thing is to, it doesn't matter if you're not taking any medications or not, at least be in a Medicare Advantage plan that has prescription drug coverage in it. You're not taking any medication, but you've got coverage, so you'll never have a penalty. And we make sure we go through all that also. Extra help. If you have extra help, which is, go back here. Extra help is from through Social Security. If your income is around $1,700 a month or less, I always tell my clients apply for extra help. It'll reduce the cost of medication substantially. And if you do are approved for extra help and you have a late enrollment penalty, it goes away. So there is a lot of benefits out there for people with low income. And it's important to educate people on what those are. They deserve it. Medicare and Medicaid. Well, Medicare, as we know, is a federal government program. Medicaid is a state program. And there are different levels of Medicaid. And if you qualify for Medicaid, then you are able to enroll into what we call dual special needs plans. And what those are is the cost of your medications. Obviously, if you are qualified for Medicaid, you automatically qualify for extra help. So the cost of your medications will be low. You can get on certain plans where the cost of your services can be zero. Also, a lot of other types of dental benefits that you would not get on a Medicare Advantage plan necessarily. And so those that qualify for Medicare and Medicaid, there are special plans called dual special needs. Okay, you need help with the Medicare drug costs. You may qualify for extra help. And you can call Social Security, you can go to Medicare.gov. And it helps to pay for your monthly premiums, deductibles, co-insurance, co-pays, and the coverage gap. You don't have the coverage gap, they don't enroll if you're on extra help. So if people are in that category of low income, there are programs out there that help them. What is required research to be completed? As I mentioned, you need a list of your physicians. Spelling very important. Because when you go into databases and, if you ever looked at a directory of physicians, can't even pronounce the name sometimes. They're not Smith and Jones anymore. There are a lot of different variations. And the spelling is very important. And also we need to know what clinics they practice. We make sure that clinic is also contracted. A list of current medications or any medication that your doctor you've had a discussion with your doctor and said, we might want to think about this medication for next year. And I tell my clients at this time of year, you're taking expensive medications. You had a discussion with your doctor and he or she says, we might want to try a different medication next year. Let's find out what that medication is. Let's make sure that medication is in your drug formulary for next year, just in case it is prescribed. As it's prescribed and it's not, it can be very expensive, right? So that kind of important also. How many dosages, how many times per day, capsule, tablet, this all seems like it's not important information, but it's very important to determine whether those medications are covered in the cost. You need the name of your current pharmacy to see if that might be a preferred pharmacy. And you can still go there to get your medications at the lowest cost. And also what other benefits are important to you. So we've got the plan, we've narrowed those 50 plans down to the plans that all your doctors are contracted with and all your medications covered. Let's say there's 5 plans. And then, okay, what's next? Well, I'd love to have dental. Okay, let's see which plans have the stronger dental plan. Or maybe you need hearing aids. What plans have the best hearing aid? And then what we do is we narrow those down to the few plans and then we review them, we take a look at the benefits, look at the costs, and then you determine yourself what plan you want to enroll. So that is the end of the seminar. Are there any more questions? We have a couple of great questions here earlier.
I got a
Yes.
question.
Yeah.
Many people change plans as they approach an older age. I went from 65 to 75, now 85. And I found out through some bitter experience that you established a profile which puts you into an ineligible category. And I would like your comment about that. How would you solve that issue? How would you approach that issue?
I wouldn't know what you're referring to. I've never heard of anybody being put into a category.
Okay,
Yes.
okay, specifically, health changes have not occurred at age 75. And then changing into going to another type of insurance. I was ineligible for the insurance. I wanted to change back and I exceeded the age. I couldn't pass the screening exam to get back into the other insurance program.
You might be referring to a supplement plan.
Yes, I am.
Okay, that is, yes, supplement plans are different from Medicare Advantage. Medicare Advantage, you can change every year. A supplement plan, an example. And on Medicare Advantage plans, they have what we call a maximum out-of-pocket cost. $6,500, let's say. Okay. If you ever reach that $6,500 after all your medical costs, not prescriptions, but you've been to the hospital 3 times, you've had radiology services, you've had chemotherapy, you've had, all of those costs reaches that maximum out of pocket, you pay nothing more for the rest of the year. When people have those type of costs, they say, well, why don't I go to a supplement plan that costs me $200 a month? That's $2,400 a year. My cost last year was $6,500. I want to go into a supplement plan. You would have to go through health questions to be able to be approved with a supplement plan. Yeah.
Make it legit.
That's exactly right.
They can reject you. They can. Exactly. That's correct.
Can a supplement plan reject you while you're signed up for it?
No.
Like
Yes.
if you have a health event or something.
Well, so when you turn 65, and you decide to go on supplement, they must accept.
Okay.
Also, if you're 75 and you're retiring, they accept you.
But if you want to switch and you're already in a plan, a supplement or a advantage plan, then supplement can.
They can deny you. There's an application that has, like, I was looking at it yesterday. I was talking to a client about this. Who's thinking about doing this. He's on a Medicare Advantage plan. He wants to go to a supplement. And I think there's 36 health questions. You have to answer those and then put in your medications also. And they're going to determine whether you will qualify or not. If you're healthy enough, they'll accept you. If not, they don't need to. That's part of it. Because in that situation, you're going, that example I gave you, you're going from $6,500 a year to $2,400 a year. You can see any doctor you want. You don't have a referral. They're great plans. That's why when people are first become eligible for Medicare, whether age 65 or off an employer plan, a retirement plan. But that's one of the questions I asked them. I explained to them there's 2 different types of Medicare plans: there's Medicare Advantage and supplement plan. What's the difference and why? Different. Well, here's why. If you're concerned about health costs down the road, supplement plan may be better for you. You better enroll into it now because you might not be able to get into it. Yes.
Yeah, my first year thinking 65, which I think is the lucky year that we're full retirement was to 70, so it's going up, I think. But my question about Medicare, does that age eligibility age go up to in the future, or is that always for now only 65?
As far as I know, it's going to be 65.
Okay.
And the other thing too is, did you know that somebody can be eligible for Medicare if they're under 65? They can. No, if you're on disability for 24 months, I have some clients that are in their 50s that are on Medicare. They were on disability for 24 months. Then on the 25th month, they become eligible for Medicare. And then we enroll them. Yeah, great question, but I'm assuming that I haven't heard any changes now for that. Yes. Nelda? Oh.
Well, I'm not making money, I'm making a choice, I'm staying in the advantage plan.
Okay, so you're
I have a point.
right. That's what.
Let's talk afterwards. I want to talk, I want to give you a potential option.
Thank you.
Yeah.
Appreciate it.
That's a great question. Glad you brought that up because it's a very unusual situation.
But it is very healthy until I
Yeah.
had a light stroke and bingo, things change just instant.
Yeah,
And the whole, your status changes. And
yeah. Yeah, absolutely. Yeah. Any more questions? Great group.
We will be posting this, well, it will remain on live on Facebook, and we'll also be posting it on our YouTube channel. And we may get questions due to people watching that later, if so, we'll pass them.
Yeah, and they can give me a call at any time.